Okay, so you're here because, well, you're driven right. You're always pushing the limits, whether it's in your career, your workouts, or even just in your everyday life.
You're striving for a more vibrant and fulfilling existence.
Exactly. And you know that frustrating feeling when stress from work, or maybe it's an old injury, acting up?
Or just simply time.
Yeah,
Starting to catch up with you. It starts to slow you down.
it can really take the edge off, you
Yeah.
know? And that's where this deep dive comes in. We're going to be exploring stem cell therapy.
Welcome to STEMCIERGE, your global concierge for advanced regenerative medicine. Here, we explore the science and breakthroughs redefining longevity and human performance, giving you clarity, confidence, and trusted insights as you navigate stem cell therapy around the world. Let's begin our deep dive.
It's a pretty interesting approach, and it goes beyond those typical Band-Aid solutions out there.
It's not just masking symptoms, it's about actually improving your body's ability to heal and regenerate at a cellular level.
Basically, think of it this way. If a crucial piece of equipment breaks down, you don't just slap a temporary fix on it, right?
You find a solution that actually restores it back to its prime,
And that's the core idea behind stem cell therapy.
aiming for those long-term, sustainable improvements to your overall well-being and performance.
And for those of you who are all about efficiency and those lasting results, this is really a game changer.
You're not interested in just another quick fix that fades away after a few weeks. You're looking for strategies that are going to keep you going strong for years and years.
And as part of the STEMCIERGE team, that's exactly what we're passionate about.
We're dedicated to providing high achievers like you with that clarity and those actionable insights into stem cell therapy and regenerative medicine as a whole.
You could think of us as your guides. We bridge that gap between the cutting-edge science and how you can actually apply it to your life, so you can make well-informed choices.
Exactly. We want to make sure you're equipped to make the best possible decisions about your health. So the aim of this deep dive is pretty simple, really. It's to give you a solid and evidence-based understanding of how stem cell therapy can be a huge help in keeping up your high performance.
We'll dig into how it can make your recovery faster,
Address those root causes so you can have long-lasting vitality.
and basically give you all the knowledge you need to see if this innovative approach is the right fit for you and your personal goals.
Okay, so let's get into why stem cell therapy is causing such a buzz, especially for people who are constantly pushing their physical and mental limits.
Demanding a lot from their bodies.
Yeah, exactly. We've talked about those long-term solutions. Why is that such a huge deal, especially for our listeners?
Well, for high achievers like yourself, time is incredibly valuable, right?
Mm-hmm.
And traditional methods for dealing with injuries or those age-related declines often mean long recovery periods or constantly managing symptoms.
It can really drag on.
It can. Stem cell therapy offers the possibility of speeding up healing and tackling those root causes of these problems.
Getting you back in the game faster.
Much faster. It basically means less time sitting on the sidelines and more time performing at your best. You're investing in your long-term capacity to perform at your best.
So when we're talking about specific benefits, what really stands out to you? What are the key advantages that resonate with this need for efficiency and that sustained level of performance?
So there are a few that come to mind immediately. First, there's the potential for much faster recovery compared to those traditional treatments.
Much faster.
Yes. So if you're sidelined by an injury, stem cell therapy is aimed at getting you back to your demanding schedule or your training regimen way quicker.
That's a big plus for people who are always on the go.
Right. And second, it's about getting to the root of the problem, not just covering up the discomfort.
Addressing the underlying cause.
Exactly. By repairing that damaged tissue, stem cells can lead to those long-lasting improvements. So you're less likely to have those recurring issues that can totally throw you off track.
So you're not constantly battling the same problems over and over.
Yeah, it's about getting ahead of the curve. And then there's the idea of actually boosting performance beyond just recovery, which is incredibly compelling, wouldn't you say?
It is. It's like taking things to the next level. But is that a realistic possibility?
Well, in certain cases, absolutely. You see, by encouraging the regeneration of tissues like cartilage or muscle, there's the potential to not just get back to where you were before, but to actually enhance your physical function overall.
So it's like an upgrade, potentially?
Yeah. And it could even boost performance levels in some cases. Think of it as reinforcing your body's infrastructure, making it even more resilient.
And of course, for many people, the idea of being less reliant on long-term meds or invasive procedures is a huge plus.
It definitely is. By promoting your body's own healing mechanisms, Stem cell therapy might even help you avoid those ongoing pharmaceutical interventions or those more drastic surgical options down the line.
Potentially avoiding surgery altogether.
Potentially. And that's really the core appeal for people who are driven to achieve and maintain that peak performance and vitality for the long haul.
So the why is becoming much clearer, but what about the how? Can you break down the science behind stem cell therapy? What makes these cells so special?
At the heart of it, it's the amazing ability of stem cells to do two things.
What are those?
First, they can self-renew,
Self-renew meaning?
meaning they can create more copies of themselves.
Oh, interesting.
And secondly, they can differentiate into specialized cell types.
Okay, break that down for me.
Think of them as these adaptable building blocks. They can not only multiply but also transform into the specific components needed for repair.
Whatever your body needs at that moment.
Exactly. Whether it's a muscle fiber, a cartilage cell, or a nerve cell, they can become what's needed.
That's fascinating. So if you have damaged tissue, these stem cells can actually become the new cells needed to repair it.
That's the idea. This inherent capability is the key to repairing and regenerating tissues that have been damaged by injury, chronic conditions, or just the effects of aging.
And that's a huge difference compared to those conventional treatments that often just focus on relieving symptoms. This is about true healing.
That's exactly it. It's about addressing the root cause and promoting real, lasting repair.
What is it about stem cells that allows them to be so effective in this repair work? What's happening at the biological level?
Well, there are actually several mechanisms in play. First, you have their regenerative potential.
Which means?
They have the direct ability to replace damaged cells with healthy new ones. It's like swapping out those old, worn-out parts for brand new ones.
A cellular renovation.
Exactly. Then there's their incredible ability to regulate inflammation.
Inflammation being a key player in so many conditions.
Oh, absolutely. And stem cells can actually release molecules that help to calm down this chronic inflammation, which, as you said, is a factor in a lot of degenerative conditions.
So they're like the peacekeepers of the body, calming things down.
Exactly. And another key factor is their ability to speed up recovery, accelerating that healing process at the most fundamental level, the cellular level.
So they're like the fast-forward button on healing.
Kind of, yeah. And lastly, their versatility is a huge asset.
In what way?
Different kinds of stem cells can differentiate into a wide variety of specialized cells. This means they can be used for many different therapeutic applications.
Targeted treatments.
That's the goal. So we've covered the potential, the mechanisms, and the versatility. But how does stem cell therapy actually work in a practical sense? What does the process involve?
Yeah, let's walk through that.
Well, typically it begins with collecting the stem cells. Now, these can either be autologous, meaning they come from your own body, or allogeneic, meaning they come from a donor.
Ah, so two sources for the cells.
Right. Once they're collected, these cells are carefully processed in a specialized lab to make sure they're both viable and pure. And finally, these prepared cells are then administered, usually via injection, directly into the area that needs treatment.
So it's a very targeted delivery system.
Exactly. It's all about precision.
And what's the ultimate goal of that injection? What are you trying to accomplish?
The main objective is to jumpstart your body's natural healing process.
To kickstart things.
Yeah, exactly. By delivering a concentrated dose of these powerful cells to the site of the injury or degeneration, we're aiming to reduce inflammation and supply those essential building blocks and signaling molecules that help support and accelerate tissue regeneration.
Giving your body what it needs to heal itself.
That's the idea. You mentioned signaling molecules earlier. Could you explain how these cells communicate with each other to promote repair?
Oh, you mean like a cellular conversation?
Yes, kind of. There are a few key ways they interact with their surroundings. One is through homing, where the injected stem cells actually migrate to the exact location of the injury or inflammation.
It's like they have a GPS system guiding them.
Exactly. It's pretty remarkable, right?
It is.
And then you have differentiation.
Okay, remind me what that is again.
This is where they change into the specific cell types that are needed to repair that damaged tissue.
They become specialists.
Yep. And very importantly, they also do something called paracrine signaling.
Now, that one sounds a little complicated.
It is a bit technical, but basically it means they release all sorts of bioactive molecules like growth factors and cytokines.
What do those do?
Those act on the cells around them, further reducing inflammation and encouraging even more regeneration.
Like a ripple effect.
Exactly. And sometimes they can even help to modulate the immune response, which is especially important in autoimmune disorders.
It sounds like a really sophisticated and targeted approach to healing. Now, we know there are different types of stem cells, and we hear a lot about those differences. What are the main types used in therapy that our listeners should be aware of? And why is it important to know which is which?
So not all stem cells are created equal. Different types have unique properties that make them more suitable for certain therapeutic goals.
So you're choosing the right tool for the job.
Right. Let's talk about some of the key players here. First, we have mesenchymal stem cells, or MSCs, which are probably the most widely used in regenerative therapies.
MSCs, we hear that term a lot these days. What can you tell us about them?
They're pretty amazing. They can be derived from various tissues, including bone marrow, adipose tissue, which is fat, and umbilical cord tissue.
So multiple sources.
Yeah, that's a big part of why they're so widely used. They're also incredibly versatile. They've shown great promise in treating a wide range of conditions like joint injuries, cartilage defects, tendon damage, and just generally reducing inflammation throughout the body.
So they're pretty multi-talented.
You could say that. What makes them particularly well-suited for those kinds of musculoskeletal issues?
Right, because we hear about MSCs a lot in that context.
Well, they have some key advantages. First off, they've got strong anti-inflammatory properties.
And that's critical for addressing many orthopedic and musculoskeletal conditions.
Oh, absolutely. Inflammation is a huge factor of those conditions.
Right.
And then they have this amazing ability to differentiate into those key tissue types like cartilage, bone, and muscle.
So they can actually become the building blocks for those structures.
Exactly. And Dr. Arnold Kaplan, who's a pioneer in MSC research, he puts it really well.
What does he say?
He says MSCs act like these medicinal signaling cells that not only differentiate into various tissues, but also modulate inflammation.
So they're doing double duty.
Exactly. And that's what makes them so effective for orthopedic applications.
So two birds with one stone.
You could say that. Now, what about hematopoietic stem cells, or HSCs?
HSCs. Yeah, those are the ones we often hear about with blood disorders, right?
Right. You're spot on. Hematopoietic stem cells are mainly sourced from bone marrow, peripheral blood, and umbilical cord blood. Their primary role is generating all the different kinds of blood cells in our bodies.
Red blood cells, white blood cells, platelets, all that.
All of it. So naturally, their main clinical uses are in treating blood disorders like leukemia and lymphoma, and for bone marrow transplants.
So a very different focus compared to those MSCs.
Very different. Now, shifting gears a little bit, let's talk about the origin of the cells themselves. Autologous and allogeneic.
Yeah, we touched on that earlier. Can you explain the key differences between those two?
Sure. So autologous stem cells, those are harvested from the patient's own body.
So it's like you're your own donor.
Exactly. And typically these are collected from either bone marrow or adipose tissue, and then those cells are processed and then given back to that same patient.
So it's a closed loop.
Right. The biggest advantage here is that there's a much lower risk of immune rejection.
Because your body recognizes the cells as its own.
Precisely. Autologous MSCs are often used in applications like joint repair, some anti-aging therapies, and muscle regeneration.
And allogeneic stem cells, those are the ones from a donor, right?
That's right.
When might those be the better option?
Well, allogeneic stem cells are sourced from donor tissues, things like umbilical cords or bone marrow, and they're frequently used for conditions like genetic disorders or when a patient just doesn't have enough viable cells of their own for the therapy.
So when using your own cells isn't an option.
Exactly. A key advantage of these allogeneic cells is that they're readily available. They're like an off-the-shelf option, which can be really important when time is critical.
So for more urgent situations?
Yes. Now, the downside is that since these cells are coming from a different person, there's a higher chance of immune rejection.
That makes sense. Your body might see them as invaders.
Right. But luckily, careful donor matching and immunosuppressive medications can help reduce that risk.
So it's not an insurmountable obstacle.
Not at all. And then we have another interesting type of stem cell called induced pluripotent stem cells, or iPSCs.
iPSCs, yeah. We mostly hear about them in the context of research, though, right?
You're right. They're mostly in the research realm for now, but they're super interesting. They're created by taking mature, specialized cells, like skin cells or blood cells, and reprogramming them back into a stem cell-like state.
So they're basically turning back the clock on these cells.
Exactly. And this gives them the potential to differentiate into almost any type of cell in the body. It's pretty remarkable.
So they're like the ultimate chameleons of the cellular world.
You got it. And this incredible flexibility makes them incredibly valuable for things like disease modeling, drug testing, and hold huge promise for future therapeutic applications, especially in areas where other stem cell types might not be suitable.
So they're opening up a whole new world of possibilities in medicine.
Absolutely. They have the potential to revolutionize how we approach treating a wide range of diseases. But there's still some hurdles with iPSCs before they can be used widely in clinical settings, right?
Yeah. What are the main challenges?
The main concerns are the risk of uncontrolled cell growth, which could lead to tumors forming and issues with genetic stability.
So making sure they're safe and predictable.
Right. A lot of research is focused on addressing these issues right now. But for the time being, iPSCs are primarily being used in research labs rather than for widely available treatments.
Just a quick break. This episode is brought to you by STEMCIERGE. If you're exploring stem cell therapy or evaluating clinics around the world, visit STEMCIERGE.com and take the free quiz to receive your personalized assessment. You'll get expert feedback on your eligibility, treatment options, and potential destinations, empowering you to make informed, confident decisions in the world of regenerative medicine. Visit STEMCIERGE.com today. Now, back to the episode.
Okay, so that gives us a good overview of the different types of stem cells out there. But how does someone actually decide which type is best for them? How do you choose the right one?
Choosing the right stem cell type is a big decision, and it depends on a few key things.
What are those?
First, it's the specific condition you're trying to treat. Like we talked about earlier, MSCs are often the go-to for those musculoskeletal problems, while HSCs are the standard for blood disorders. The patient's overall health is another big factor.
Things like their age, lifestyle, and any other medical conditions they might have.
Exactly. All of that plays a role. And then there's the practical matter of cell availability.
Whether you're using your own cells or finding a suitable donor.
Right. Ultimately, this decision should be made with a knowledgeable regenerative medicine specialist. They can look at all these factors and recommend the most appropriate approach based on the evidence for your individual needs.
So personalized medicine is really key here.
Absolutely. Every patient is unique, and their treatment should reflect that.
Okay, so we've covered the science and the different types of stem cells. Now let's get into what a lot of our listeners are probably most interested in. The actual clinical applications and the success rates we're seeing in different areas. What can people realistically expect from this therapy?
Yeah. It's important to be realistic here. We need to highlight areas where there's solid clinical evidence and acknowledge areas where research is still ongoing.
So let's be transparent about the current state of the science.
Exactly. Let's start with orthopedic and musculoskeletal conditions.
Okay. Those are pretty common, especially among people who are very active and physically demanding.
Very common. We're talking about things like osteoarthritis, tendon injuries, cartilage defects, and ligament damage.
Painful stuff.
It can be very painful and debilitating. And like we mentioned, mesenchymal stem cells, those are the main cell type used for these problems.
And what kind of success rates are we seeing in these orthopedic cases? What can someone realistically expect if they decide to go this route?
Clinical studies have shown that MSC therapy can lead to significant improvement for a lot of patients. Some people report a 60 to 75% reduction in pain and increased joint mobility within about 6 months after treatment.
That's a big improvement.
It is. And the recovery time frame usually takes about 3 to 6 months. People see gradual improvements as the tissues regenerate. And importantly, especially when using autologous MSCs, the safety profile is generally pretty good.
So relatively low risk.
Relatively, yes. So for someone dealing with chronic joint pain or a sports injury that just hasn't gotten better with traditional treatments, this could be a real game changer. It could be the key to getting back their function and relieving their discomfort.
That's very encouraging. Now, what about neurological conditions? That seems like a much more complex area to treat.
It is more complex. There's a lot of exciting research happening in this area, but for many neurological conditions, clinical applications are still mostly in the experimental stage.
So there's potential, but it's still early days.
Exactly. We're looking at conditions like spinal cord injuries, multiple sclerosis, and stroke recovery. Neural stem cells and iPSCs are often the focus in this research.
And what are the preliminary findings showing?
Well, early studies have shown some potential for improving motor function and cognitive abilities, but we still need more long-term clinical trials to really determine the success rates and figure out the best treatment protocols.
So it's a promising area, but still a lot to learn.
Right. Now let's talk about cardiovascular conditions. What role might stem cell therapy play in heart health?
This is another area where it's showing potential, especially in helping the heart recover.
That's right. Applications are being explored for conditions like heart failure and helping people recover after a heart attack. Both hematopoietic stem cells and mesenchymal stem cells have been studied for this.
And what are the results looking like so far?
Some studies have reported up to a 50% improvement in cardiac function in patients who've received stem cell therapy.
That's a significant improvement in heart function.
It is, and it seems to be particularly effective when it's given soon after a heart attack. The mechanisms behind it are thought to be related to promoting the growth of new blood vessels.
That's angiogenesis, right?
Exactly. Angiogenesis and reducing the formation of scar tissue in the damaged heart muscle. But it's important to emphasize that these are complicated conditions, and selecting the right patients and treatment protocols is absolutely crucial.
So it's not a simple solution, but it holds promise.
Right. What about autoimmune and inflammatory conditions? That's a pretty broad category.
It is. There are a lot of different diseases that fall under that umbrella.
And this is where those immune-modulating properties of MSCs that we talked about earlier come into play. Research is currently looking at conditions like rheumatoid arthritis, Crohn's disease, and lupus.
So conditions where the immune system is attacking the body's own tissues.
Exactly. Now, stem cell therapy isn't considered a cure for these diseases, but clinical trials have shown that MSC therapy can significantly reduce symptoms and improve quality of life for some people.
So potentially providing relief for those who haven't responded well to other treatments.
That's the hope. The idea is that the stem cells can dampen that overactive immune response and promote tissue repair.
Calming down the immune system and allowing the body to heal.
Exactly. And the risks associated with these treatments are usually pretty minimal, mostly just reactions at the injection site.
So relatively safe overall.
Relatively, yes. Lastly, let's touch on something I know a lot of our listeners are interested in, which is the anti-aging and aesthetic applications of stem cell therapy.
Yeah, those are definitely getting a lot of attention.
They are. People are exploring applications for skin rejuvenation, hair restoration, and even treating age-related joint pain. Autologous MSCs, often derived from either adipose tissue or bone marrow, those are commonly used in these applications.
And what's the evidence showing so far?
The evidence is still emerging, but it looks like these treatments can improve skin elasticity, reduce age-related joint discomfort, and generally enhance tissue quality.
So potentially turning back the clock on some of those visible signs of aging.
Potentially, yes. But it's important to note that we're still collecting long-term data in this area.
So it's a bit too early to make definitive claims.
Right. But it's a very exciting area to watch.
Absolutely. So we've covered a lot of ground here, talking about the different ways stem cell therapy can be applied clinically.
And it really highlights the potential of this approach to address a wide range of health concerns.
Now, across all these different applications, are there any common factors that seem to influence whether stem cell therapy is successful or not? What are the key things that determine the outcome?
That's a great question. There are definitely several factors that come into play. The source of the stem cells is important.
Like we talked about, autologous versus allogeneic.
Right. Autologous cells usually have a lower risk of rejection. The specific condition being treated is another big one. As we've seen, some conditions respond better to stem cell therapy than others.
Right. It's not a magic bullet for everything.
Exactly. And then there's the patient's overall health.
Things like their age, their lifestyle habits, and any other health conditions they might have.
All of that can influence the outcome. And lastly, the specifics of the treatment protocol itself.
Things like the number of cells they're given, how the cells are prepared, and how they're delivered into the body.
All of those details can impact the effectiveness.
So it's a complex interplay of factors.
It is. That's why it's so important to have an individualized assessment and personalized treatment plans.
So one size does not fit all.
Definitely not. Now, as exciting as the potential of stem cell therapy is, it's also crucial to be aware of the potential risks and limitations. We want to be completely transparent with our listeners here.
Yeah. It's important to have a balanced perspective.
Absolutely. So while it's generally considered a safe procedure, there are some potential risks to be aware of.
What are some of the main ones?
Infection at the injection site is a possibility. It's rare, but it can happen with any kind of invasive procedure.
That makes sense.
Immune rejection is a bigger concern with allogeneic stem cells.
Because the body might see those donor cells as foreign invaders.
Exactly. There's also a theoretical risk of uncontrolled cell growth, which could lead to tumor formation.
But you mentioned earlier that's mainly a concern with iPSCs.
That's right. It's less of a concern with the types of stem cells that are commonly used in current therapies. And finally, it's really important to have realistic expectations and understand that there's no guarantee of success.
It's not a miracle cure.
Not at all. Not everyone will see significant improvements, especially for those conditions where we don't have a lot of long-term data yet.
So being informed and managing expectations is crucial. And we've also heard some words of caution from experts in the field, haven't we?
Yes, we have. Dr. Paul Nuffler, a respected stem cell researcher, has warned patients to be wary of clinics that promise guaranteed results without providing any data from rigorous, peer-reviewed clinical trials.
So basically, don't believe the hype, do your
Yeah,
research.
exactly. It's so important to be discerning and get your information from credible sources.
So given all this information, how should someone approach making a decision about whether stem cell therapy is right for them? How should they navigate this process?
It can definitely feel overwhelming. There's a lot to consider. The first step is to clearly define your own personal health goals. What are you hoping to achieve with stem cell therapy? Is it to alleviate pain, improve your recovery after exercise, address a degenerative condition, or simply enhance your overall well-being?
So start with the why. What's your motivation?
Right. Once you have a clear understanding of your goals, it'll be easier to focus on the types of stem cells and therapies that might be most relevant for you.
So if you're dealing with a specific joint injury, for example, you might want to look into those MSC-based therapies.
Exactly. Starting with your desired outcome can help you narrow down your options.
What's the next step in the evaluation process?
Next, it's essential to do your research and thoroughly evaluate the clinics and practitioners you're considering.
So don't just go with the first one you find.
Definitely not. Look for board-certified physicians who specialize in regenerative medicine, and make sure they have experience with the specific type of stem cell therapy you're interested in.
So you want someone who's qualified and experienced in that particular area.
Right. And ask about the clinic's accreditation. Find out about the qualifications and expertise of their medical team. Check their track record of successful outcomes. Look for patient testimonials and published clinical data.
So basically check their credentials.
Yeah. And look for evidence that they're getting good results. And transparency is key. They should be willing to clearly explain the treatment plan. What type of stem cells are they using? How will they be administered? What are the potential outcomes? What are the risks? What kind of post-treatment care can you expect?
So you're looking for open and honest communication.
Exactly. You shouldn't be afraid to ask questions. And don't just take their word for it. It's important to examine the scientific evidence yourself.
Right. Be proactive.
Yes. Any reputable clinic should be happy to provide you with information on the peer-reviewed scientific literature and clinical trial results that support their treatment approach.
So ask for that information and don't hesitate to do your own research as well.
Right. Be an informed patient. And ask about their risk assessment protocols.
Things like how they ensure sterility, how they screen donors if they're using allogeneic cells, and their procedures for monitoring your progress after the treatment.
All those details are important, and of course, for most people, cost is a major consideration.
It's a big factor.
It is. And stem cell therapies can vary a lot in price depending on the type of cells they're using, how complex the procedure is, and the location of the clinic.
So you'll want to get a clear understanding of all the associated fees.
Definitely. That includes the initial consultation, the cell collection and processing, the administration of the therapy itself, and any necessary follow-up care.
So factor in all those costs.
Yes. And it's also important to find out if your health insurance will cover any part of the treatment. Unfortunately, a lot of stem cell therapies are still considered experimental by insurance companies, so coverage can be limited.
So be prepared to potentially pay out of pocket.
It's a possibility, yes. So after you've gathered all this information, it's time to carefully weigh the potential benefits against the risks, consider the costs, and make a decision that aligns with your personal situation and comfort level.
So it's a personal decision.
It is. Think about your individual health factors. Have realistic expectations about what the therapy can achieve. Compare it with any other treatment options that are available.
So explore all your options.
Right. And importantly, we highly recommend talking to a regenerative medicine specialist who can give you an objective assessment of your situation and guide you towards the most appropriate, evidence-based approach for your health goals.
So seek out expert advice.
Yes, it's invaluable in this process.
And this is where STEMCIERGE comes in. We can be a valuable resource for our listeners who are trying to navigate all this information. How do we help individuals make those decisions?
Navigating the world of stem cell therapy can be really confusing and overwhelming. That's where we come in. At STEMCIERGE, we offer personalized guidance and support to help you through the process. We help you assess your options based on your unique health profile and goals. We help you understand the science behind the therapy, and we connect you with reputable clinics and practitioners who have high standards for safety and effectiveness.
So you're like a concierge service for stem cell therapy.
You could say that. We're here to demystify the field and empower you to make confident choices about your regenerative health journey.
So it's about taking the guesswork out of the equation.
Exactly.
Thank you for listening. If you found this episode valuable, please leave us a 5-star rating and review, then share it with someone who may benefit from it. For global insights and personalized guidance on stem cell therapy, visit STEMCIERGE.com to receive your tailored assessment and explore your treatment options with clarity and confidence. And as always, remember, this podcast is for educational purposes only and is not a substitute for professional medical advice. Please consult your doctor before making decisions about your health. Until next time, stay informed, stay empowered with STEMCIERGE.com.